I do remember even early on in grade school thinking about becoming a physician. I've always sort of been fascinated by the way the brain and the spine work. During the time I was an undergraduate, I actually did some research, including neuroscience research in Parkinson's and Alzheimer's disease. And so because of my interest in sort of neuroscience and because I felt I could do more good for individual patients as a surgeon, it kind of merged those two things to do neurosurgery. My name is Kager. I'm a neurosurgeon here at Lancaster General Hospital at Penn Medicine. The majority of what I do is clinical neurosurgery, so seeing patients in the office and performing surgeries and also covering call responsibilities for any emergencies or trauma. I would say the focus of my practice typically is about 90 to 95% spine, including complex spine issues. I do a little bit of other work in like peripheral nerve and occasionally cranial work, mainly as it relates to trauma. The hallmark of how I approach care is that every patient is an individual. I don't think that you can develop an approach that's what we would call a cookie cutter approach, that everybody that comes in with this problem, gets the same thing. So it's very much an individualized approach, and every patient is highly involved in their own sort of care with regards to discussing and choosing the options that are appropriate for them. My first comment is always, let's start from the beginning. So I like to get that sort of full comprehensive history. When did it start? What have you tried? How has it been recently? What helped you? What didn't help you? And sort of set a baseline level of how much this is interfering with their life in general. And then kind of coming up with the best sort of individualized plan for that patient. I think the best part of my job is seeing when patients recover and have successful outcomes, whether that's with or without surgery. It's always gratifying to hear them say, this is the first time I haven't had pain in 5 years. So I think hearing that is probably the most rewarding thing I see on a daily basis.